This conference will now be recorded.
So, hello everyone. I hope my voice is audible to everyone.
Yes.
Yeah, thank you. So, now we should really begin today's program. So, as our first talk is presented by yesterday, who have Dr. Sandra Oliveira, but she cannot able to present today. So, we have to skip her talk and go to the next talk by Dr. Muhammad Amin Makaram from Shahid Shamran University of Hawaz, Iran. Hello, Dr. Muhammad.
Hello, can you hear me?
Yes. So you ready to give the talk?
Yes, I am.
Yes. So you are the presenter now. Please click on the share icon. You have the third one at the center of your screen at the bottom.
Yes, please give me a moment.
Okay. Yes,
So
we can
can
able to
you
see your
see
screen.
my
Yes,
screen?
yes. Yeah, you can make it a full screen and from the start you can start.
Okay, let me minimize the.
Perfect.
So how can I minimize the right
Uh,
sidebar?
uh, that is only visible to you, not for us. We can only able to see your full screen.
Yes. Okay.
Yes, you can start presenting.
This sidebar is giving my screen. I want to moving out it from the screen, but I cannot. When I click on the
Can
cross.
you see that on the top right corner there are two arrows facing each other? You can click on that. That is the collapse button. Maybe it will drop down.
Yes, now it is okay.
Okay.
So my presentation is about drug delivery by anodic nanostructures, especially by anodic aluminum nanostructures. And I am Mohammad Amin Makarem from Shiraz University with my colleague Hoda Sabati from Shahid Shamran University, Ahvaz. So to have an overview about the presentation, I must mention that drug delivery has improved significantly with recent advancement in nanofabrication techniques, including enhancing patient safety, bioavailability, and therapeutic efficacy. Anodized nanoporous anodic alumina, as known as NAA, has received considerable attention in recent years for the development of the drug delivery systems. So the objective of this presentation is to show you advances in drug delivery nanostructures based on NAA. And we discuss several methods about it, and then we show you some results and provide discussions about how this anodic nanostructures works, and then we compare various drug delivery systems. So we first start with an overview of drug delivery, and then talk about drug delivery systems and their advantages and disadvantages, factors affecting the drug delivery and its mechanism. And then we reach to nanoscale drug delivery systems. Metallic nanoparticles are then discussed, and inorganic nanoporous structures in drug delivery is then presented. Nanoporous anodic alumina, their fundamentals, structure, and properties is the subject of the next discussion, and biocompatibility of NAA, its structure and surface modifications are then discussed. Stimuli-based strategies for controlled drug release are then presented. So what do we mean by drug delivery? The concept of drug delivery includes approaches, formulations, manufacturing techniques, storage systems, and technologies for delivering pharmaceutical compounds to their target sites. The preparation of drugs, routes of administration, site-specific targeting, metabolism, and toxicity of drugs are all factors that determine effectiveness and safety, as well as patient convenience and compliance. Drug delivery is a broad field of research on the development of novel materials or carrier systems for effective therapeutic delivery of drugs. The drug delivery may be steady, controlled, or targeted. Drug delivery is aimed at altering a drug's pharmacokinetics and specifically by formulating it with different excipients, drug carriers, and medical devices. There is additional emphasis on increasing the bioavailability and duration of acting of a drug to improve therapeutic outcomes. A drug delivery system known as DDS is defined as a formulation or device that enables a therapeutic substance to selectively reach its site of action without reaching the non-target cells, organs, or tissues. Drug delivery systems describe technologies that carry drugs into or throughout the body. These technologies include the method of delivery, such as pill that you swallow or a vaccine that is injected. Drug delivery systems can also describe the way that drugs are packaged, like a micelle or nanoparticles that protects the drug from degradation. We have various drug delivery systems such as buccal, sublingual, vaginal, rectal, and etc. that are shown here. But what is the advantages and disadvantages of drug delivery? One drug delivery system that we want to talk about is nanoparticle-based drug delivery system, which is investigated because of many advantages, such as a smaller size, controlled drug release potential, targeting ability, enhancement of therapeutic efficacy, and reduction of toxicity. Ideal characterization of nanodrug delivery system includes it should increase the bioavailability of the drug. It should transport the drug intact to the site of action while avoiding the non-diseased host tissue. In this slide, I have shown you the various drug delivery systems. We have microspheres, nanoparticles, liposomes, etc. For example, microspheres had advantage of prolonged retention time, but they have limited tumor penetration and they have risk of peritoneal adhesion. Nanoparticles, which are the subject of this presentation, has a smaller size, passive targeting, avoiding MDR, and lower incidence of peritoneal adhesion, but rapid clearance out of the abdominal cavity is its disadvantage. Several factors impact drug distribution. These factors include the concentration of drug transporters in blood, pH, perfusion, body water composition, body fat composition, and most certainly disease condition. For example, volume depletion, burns, third spacing. We have two mechanisms of drug delivery: passive targeting and active targeting. By passive targeting, we take advantage of tissue permeability, but by active targeting, usually achieved by conjugating the delivery vehicle to a targeting moiety, enabling accumulation of the drug to a specific location. Nanoscale drug delivery systems are an important route to reduce the side effect and improve the treatment efficiency of chromatography drugs. The use of nanostructured materials provide incompatible liberty to customize the intrinsic properties of drug in drug delivery systems, such as drug release characteristics, dissolution, solubility, bioavailability, and immunogenicity. Formation of a stable interaction with ligands variability in size and shape, high carrier capacity, and convenience of binding of both hydrophilic and hydrophobic substances make nanoparticles favorable platform for target-specific and controlled delivery of macro and micromolecules in disease therapy. Some conventional chemotherapy drugs used to treat cancer, for example, can increase the risk of heart problems, which can also occur with radiation therapy, which includes myocardial infarction, heart attack, stroke, and blood clot. By using metal nanoparticle drug delivery systems, we can minimize these types of side effects because they directly target the affected organ and thereby reduces the side effects. In the field of nanotechnology, metallic nanoparticles have shown a number of properties. MNPs are extensively utilized as drug delivery carriers for various therapeutic agents. MNPs like silver, gold, palladium, titanium, zinc, and copper nanoparticles shows enhanced properties and tunable optical properties. MNPs are attained from the capability of increase the aqueous solubility of hydrophobic drug compound, enhance circulation time of drug in the blood, and repress or eliminate fast renal drug. Multifunctional nanoparticles have greater ability than conventional nanoparticles to perform several goals synergistically, such as co-delivery of multiple bioactives with imaging agents, target specific delivery through a surface ligand and decoration. In drug delivery, there are three main goals: targeting therapeutic agent to the site of action, minimizing adverse effects of the drug to the healthy tissues or organs, and controlling release of drug to avoid the classical overdosing underdosing cycles. MNPs provide a model to achieve these goals. MNPs are explored in early and clinical studies for detection, diagnosis, and treatment of several diseases. FDA-approved metal nanoparticle-based nanomedicines in clinical use have been shown to enhance the bioavailability and efficacy of drug delivery systems. By adjusting their size and shape, surface chemistry, and doping techniques, the design MNP can decompose rapidly under a specific physiological condition and are thereby easily absorbed by various metabolic pathways without affecting the healthy tissues. MNPs approved for cancer therapy by FDA or EMA and clinical trials are summarized in this table. ADME's different categories of nanomaterials developed for drug release. Inorganic nanoporous structures are the center of attraction. In recent years, nanoporous anodic alumina, NAA, porous silicon, and titania were truly investigated among all nanoporous materials, specifically for developing new drug release strategies due to excellent physiochemical properties. Among all the material mentioned, NAA remained one of the best choice due to its excellent chemical inertness, biocompatibility, enhanced mechanical strength, tunable chemistry, and control pore dimension and volume for loading and releasing drugs in a controlled manner. NAA is fabricated by simple electrochemical anodization of aluminum and consists of closely packed hexagonal arrays of nanopores from top to bottom obtained during anodization. Despite many research activities carried out in recent years, the complete explanation of self-organization process still needs to be validated. However, many studies have proved that the self-organization mechanism occurs primarily due to two reasons. The first one being the field-assisted dissolution of alumina layer at the interface of oxide electrolyte. Second reason includes localized stress between neighboring and growing nanopores at the interface of metal oxide, which results in the process of self-organization in the hexagonal from the reduced mechanical stress. Classification of different anodization processes used for fabrication of NAA is summarized in the table in this slide. With its high payloading capacity and excellent homogeneous ordered structure, NAA serves as one of the excellent candidates for the drug loading and release as compared to the other porous structures due to its tremendous properties, including mechanical robustness, lightweight, bioinertness, and corrosion resistance. NAA is widely used for fabricating different templates, which can be tailored into different shapes without usage of heavy equipment and hazardous chemicals that favors mass production and industrial level. Diffusion control release profile can easily be obtained by a structural modification of NAA. Typically, the process is controlled by several factors, for example, porosity and length, diffusion coefficient, etc. There are different types of release profile that can be obtained from NAA, which includes burst release, zero order, first and second order combined or stimuli-based drug release. However, among all, zero order release is considered as one of the best release profiles. NAA serves as an excellent drug carrier for generating other types of drug release profiles, for instance, smart and on-demand sustained switchable behavior, thus reaching one step closer smaller drug delivery applications. Alumina Al2O3 is a highly insoluble, non-toxic material widely used in dental and orthopedical treatment due to its bioinertness and excellent resistance. The fabrication process of NAA does not require any heavy equipment and thus safe to use. Studies prove that NAA offers excellent biocompatibility and does not provide a threat to neighboring cell tissues and at the same time providing good cell attachments. Extraordinary research to explore NAA's drug delivery studies was performed by Desai et al., where the team studied truly NAA capacity as a cellular encapsulation to release immunoglobulin, glucose, and insulin. Results showed that glucose molecules were actively released while IgG release was significantly obstructed. Surface topology of NAA has attracted much attention in recent years, with many exciting research outputs put forward by the researchers in terms of an interaction between different cell inlines and nanostructure surface. Most of the research conducted using NAA as a template involves in vitro experiments, but when it comes to real-life application, more in vivo and in-depth studies are required, which present deep challenges. It was shown that NAA-coated stents served as an excellent platform for loading and releasing of drug within a therapeutic range, followed by significant reduction in neointimia thickness. Surface functionality of NAA is limited due to presence of oxides along with some other impurities caused by the preparation process. One of the easiest approaches developed over the years is to control drug delivery by modifying the pore dimensions and fabricating different types of nanostructures based on NAA. Some of the best methods of modifying the surface with different strategies and materials has been listed in the table below, such as grafting, chemical vapor deposition, thermal vapor deposition, etc. Stimuli-based strategies for controlled drug release is presented in the figure here. Several protocols have been developed so far to release drugs in controlled manner, but drug release still remains inconsistent for a desired period of time. To conclude, NAA has gained enormous attention in the scientific community already due to its unique properties, scalable and low-cost production. It has already been proved that homogeneous pore distribution, high surface area to volume ratio, tunability, stable physiochemical stability, and excellent mechanical strength renders this material to be widely used in biomedical applications. NAA can strictly be tailored to trigger an enhanced response from the delivery system. Integrating this material with appropriate chemistry to interact with the biological elements can be helpful in early diagnosis and treatment of several diseases. More emphasis can be given on the modified anodization procedure and stable chemistry to enhance the drug loading inside NNA. And these are some references for further reading about this subject. For example, Kaprawan et al. Or Damagolsky et al. Are the good references in the field. And thank you for attention and any question you might have.
Is not in service.
Thank you, Dr. Muhammad, for your presentation. So, anyone having any questions? So, no questions. Thank you once again for your presence and presentation.
You're welcome.
Yes. So, we tried to contact Osman and Brandon as the time is not right for the USA. So, I would request to Dr. Yuan Wei from the Chinese University of Hong Kong, China, to present his talk. Hello, Dr. Yuan.
Hi, can you hear me?
Yes. Yeah, you are the presenter now. Please click on the share icon, that is the third one at the center of your screen.
Oh, yes. Wait a minute, because
Okay.
I thought it was not my turn, so quite a bit surprised, but it's fine.
Yes, because like they have not yet joined and we really should start our program. That's why.
Yes, okay, no problem. It's been a pleasure. So, can you see my screen?
Yes, it is visible. Yes, this is the presentation. You can make it a full screen.
Yes. Oh, you're right. Can you see
Yeah,
it?
perfect. Yes, you can continue.
Okay. Hi, good morning, everyone. I'm Yuan Yuan from the Chinese University of Hong Kong, and left side is my contact. Please feel free to contact me if you have any interest of my research. So today my topic is centrifugal microfluidics for bioanalysis applications. And for attending this conference, I have focused on one specific application I will introduce later. So before I start, I'd like to make some introduction. So my work is based on microfluidics, especially droplet microfluidics. Here we may consider, when we're talking about the advantage of droplet microfluidics, we may consider each droplet as a container of the biological application. So we can perform different reactions parallelly with a large scale, and it's also well-controlled microenvironment in each compartmentalization. And when we generate the droplets are tiny and uniform with variation less than 5%. And also the experiments are high throughput. So here I show a review article published on Chemical Society Review for your interest. Here we try to get a senior perspective with the help of thermodynamic perspective to make a conclusion of the droplet microfluidics reaction. So from this figure, we can see we consider the single emulsion as a closed system because the reactions inside the droplet does not react with the environment, and the polar and nonpolar molecules are trapped inside each droplet. Well, for a single emulsion, the format is mostly water in oil or oil in water. As you might know that the droplets are formed by the different surface tension of the dispersed phase and continuous phase. Well, for multiple emulsion, it's double layer or even more layers. Here we focus on double layers. For double emulsion, it's water in oil in water or oil in water in oil. And the shell, we call the membrane as the shell. It could be programmed by applying different surfactant or different beads. We can manipulate the shell depth, and also we can control its release when it met acid or different stimulation from the environment. Well, for the all-aqueous emulsion, both the inner phase and the outside phase is water phase. It's just different water with different surface tension, so it has better transportation ability compared to single emulsion and multiple emulsion. For a single emulsion, this illustration shows the possible applications. We can generate single emulsion by oil in water or water in oil. And also there is a format of single emulsion called Pickering emulsion. We can use not only surfactant but also some beads. For applications, the manipulation of the droplets might be merging or dispersing or the others, and the stimuli may come from electric, temperature, or magnetic. And as the time is limited, here we focus on the part C, droplet PCR. For compared to the gold standard qPCR, droplet digital PCR have been more attractive because the samples are dispersed in different droplets, and each droplet could be considered as one system. If it contains one DNA, one template, it's 1, it's positive. If it contains no template, it's 0, it's negative. By this way, from Poisson distribution, we can absolutely quantify the concentration of the sample. While for qPCR, it's just relatively quantify the concentration, and with the help of housekeeping gene, some gene with known concentration. But for ddPCR, the concentration, we don't need any reference gene to with the known concentration. We can directly quantify the absolute concentration. And for multiple emulsion, while compared to single emulsion, it has better permeability, so we can control it when to release. For example, as I mentioned, maybe as it to deliver drugs, it goes into the stomach, and when it meets the acid, it may release, then the drug goes out. So it has been used for drug delivery, drug encapsulation. Also, it has been used for cell culture because it, compared to single emulsion, the oil has some effect on the cell culture, while the double emulsion is more suitable for cell culture. Also, it has better transportation ability, so the nutrient can go in while the waste can go out. For all aqueous emulsion, the generation has been a problem because we need to train the interfacial property very carefully. Otherwise, the generation will be like long jetting, not that easy to form droplets. And also, it has been used for long-term cell culture because both the dispersed phase and the continuous phase are water, so it's more suitable for cell to grow. For centrifugal microfluidics, it's actually by spin, the reaction can happen along the radius, and the Coriolis force may affect the reaction to happen. And the ddPCR I have mentioned to you. Too much, not necessary here. So I directly go to the one I'd like to share with you the most. This one. So to attend this conference, we have to do this experiment. And for better present, I showed all my results here. Here we want to know the influence of the increased mechanical loading by the centrifugal platform on the cells, on the stem cells, and the way we observe the influences by the upregulation of the calcium ions of the cells. Actually, some previous research work has reported this, but their result, they performed this kind of experiment to put the cells in a tube and put it in centrifuge. Well, here we applied microfluidics so that the centrifugal force could be better controlled, and sometimes we can even control the single cell. Because when the cell is trapped by the microfluidics chip and we know the spinning speed, we know the radius, then we can calculate the corresponding centrifugal force. Then we know the mechanical apply of the cell is accurately what kind of G. Here we have tried different spinning speed at a different time, and we see that with spinning speed goes up, the fluorescence intensity of the expression of calcium ions of stem cell has been upregulated. So this is our latest result that I want to share with you. So that's all my presentation. Please feel free to raise questions if you have any problem. Thank you. Any questions?
Thank you, Dr. Yuan, for your presentation. So, anyone having any questions?
Yeah, I have a question.
Yeah, please
Yes,
continue.
please.
Yeah, thank you for the interesting presentation. Just asking about the surfactant. Do you purchase it or you make it in the lab for this study?
Surfactant, thank you. Most of the surfactant we bought it directly. Some of our colleagues do their research in fabricating their own surfactant. You can search gold nanoparticle. Yes, my colleague fabricated surfactant by his own using gold nanoparticles so that he could use light to manipulate the droplet, to merge, and even to heat. But for me, my own focus, my research focus is more on the application or the setup instead of the surfactant. So when I do biological experiments like ddPCR or cell related, when I generate the droplets, I use the surfactant I can buy, like BioRed or PicoSurf. Thank you.
Yeah, thank you. That's answered my question.
Thank you.
Thank you very much. So, anyone else have any questions? No questions. Thank you once again for your presence and presentation.
Thank you.
Thank you. So now we can go to our next available talk is from Dr. Ganesh. Hello, Dr. Ganesh. Hello, Dr. Ganesh.
Yeah.
Yeah,
Yes.
are you available to give the talk right now?
Yeah, Ashwin, yeah, okay. No problem, I'll try.
Yes, so I'm going to make you the presenter. Yes,
Yeah.
please share your screen with us.
Is it fine? Is it okay now? Yeah. So, are you able to see my slides?
Yes, yes.
Okay. So, thank you. Thank you for inviting me for the talk. And thank you very much for introducing me. Hi, I'm Dr. Ganesh Balavalli, an associate professor from Jawaharlal Nehru Technological University, India. Today, I'm going to discuss about polyacrylic acid functionalized graphene for phototherapy of cancer and bacteria in first and second biological world. And here are the outlines of my talk: brief introduction about graphene, phototherapy, and NIR light, and how to synthesize function as a graphene in order to just have a phototherapy of bacterial cancer, and characterization with the various microscopic, ultramicroscopic, and spectroscopic techniques, and its imaging in a cellular level, and followed by cancer and antibacterial therapy by using NIR light, and finally conclusions. So here is brief introduction about carbon nanomaterials, because graphene belongs to carbon family, and based on its dimensions, we classify it into zero-dimensional fluorines and one-dimensional carbon nanotubes and two-dimensional graphene. So these are the choice of my talk. And as you know, graphite is three-dimensional. So here, graphene is a single layer of the graphite you can consider. Well, here is a brief few words about it. This is a graphene structure. This is the thinnest material in the universe has been considered. It is a flat monolayer of hexagonally arrayed sp2 bonded carbon atoms, tightly packed into a two-dimensional structure, as you can see. And it's a basic building block for all graphic materials such as fluorines, carbon nanotubes, and nanodiamonds, etc., which are displayed in the previous slide. And it has unique optical and electronic properties. It has a high surface area and biocompatibility. So because of these properties, like optical property and biocompatibility, we'd like to just demonstrate this material as a phototherapeutic material to cure cancer cells as well as disinfected bacterial disinfectant. So before just making the graphene, in order to be IR active, you have to just functionalize graphene with some other functional groups, because graphene alone is not photoactive, not very effective uh, for phototherapy. Right. So in order to functionalize any molecules on a graphene, first look at this is a kind of material called as graphene with oxygen groups. So graphene oxide you can say. It has many pi electrons as well as many oxygen functions. Right, so because of pi electrons, we can just immobilize any molecules with pi-pi interactions, non-covalent interactions. So you can just immobilize any molecules like iron molecules for MR imaging and polymer coating for biocompatibility or for viscosity, oligomers or aptamers for targeting, and therapeutic agents like platinum or any other organic compounds for effective phototherapy of cancer and cancer. Well, it also has oxygen function group so that you can go for oxygen functionalization too. Well, here you can see that at the pi bonds, previously said there is a pi-pi interaction, so that physical adsorption of any therapy molecules could be possible. At the same time, we can also just functionalize different molecules through covalent interactions. Where you can see at the double bonds, you can go for cycloaddition, or even at COH groups or OH groups, you can just functionate through covalent interactions, like substitution or elimination reactions. So this is what a graphic chemistry. In order to make a graphene into multiple functional material, so that we can just immobilize the choice of our new compound on top of it through non-covalent or covalent interactions. Yeah, so the general applications of graphene, it could be useful as a flexible electronics material, and it is very thin material, so it could able to sense even single atoms on top of it, and it is biocompatible so that we can use it for a lot of uh, you could able to use it in nanomedicine, as it has high surface area. You can make it as a component. Means you can just immobilize choice of your component just now we discussed. Yeah, here are the graphene applications in nanomedicine. You can take GMCs means graphene nanocomposites. You can see kind of layered materials, and you can functionalize with different drug molecules, and you can inject into infected mice which contain tumor as well as a bacteria. Followed by you can go for diagnosis. You get several diagnoses like CLS, MRI, CT, Raman, toxins, multimodal diagnosis you can do, because graphene could able to immobilize fluorescent moieties or nanoparticles or other therapeutic agents, as well as diagnostic materials. And after diagnosis, you can go for multiple therapies like drug therapy or gene therapy or so light therapy, which is called as photothermal therapy and photodynamic therapy, or combination therapies of chemotherapy or gene therapy or light therapy. By multiple therapies, you can just cure the existing problem of mice, whether it is a back infection or a cancer. So finally, you can achieve a goal of curing the cancer or infection. So before just discussing about phototherapy, here we are just going to use NIR light. So let me give a brief introduction about it. So here, killing the disease cells could be possible by exposing to NIR light instead of visible light or UV light, because UV light is not very good to the cells. Even visible light that cannot have good penetration, but whereas NIR light have very good penetration into the cells and even it has very less energy. As a result, NIR light is very good and effective for phototherapy of cancer. Again, NIR light could be divided into NIR1 and NIR2. NIR1 means it's the biological window, it's also called as the wavelength of light would be 700 to 900 nanometers. Whereas Ni2 means it's also called as biological window 2, and we supposed to use the light wavelength from 1000 to 700 nanometers. Well, so what is the advantage of NIR2 light than compared with NIR1? So NIR1 light has less tissue penetration and more scattering of light in the biological system, whereas Ni2 means it has very deeper tissue penetration and good photon absorption and less scattering effects, making it possible to image deeper to the underlying tissue, where you can see the graph, the wavelength and depth of different cells you can take: skin, mucus, skull, brain, mucus, and so on. Where in a visible light, the depth of penetration of light is less, whereas in Ni2 it has very good penetration. So then compared with visible and NIR1, Ni2 has very good penetration into the cells. As a result, the cells could able to absorb the light or even nanomaterial there that could able to generate heat or react to oxygen that could able to just kill the cancer cells or bacteria. Well, so when come for the phototherapy, it is again we can say photothermal therapy and photodynamic therapy. Photothermal therapy means simply burning the cells by exposing to non-invasive light, because NIR is non-invasive when compared with X-rays or even UV radiation or gamma rays and so on. Where you can see that you can just expose NIR light to the cell so that this light could able to burn the cells. But cells alone or light alone may not just uh, burn it. You need a nanomaterial which can absorb the light and convert the heat, and that heat could burn the cells. So that's why we need a phototherapeutic materials like gold or graphite or whatsoever. Simply PTT means photothermal therapy. It can heat can kill the cells. Next one is photodynamic therapy. Means here reactive oxygen species kill the cell. Means when you expose the cells which are containing a nanomaterial to the NIR light, the NIR light could able to generate electrons and holes. And these electrons and holes would convert or generate a lot of reactive oxygen species like singlet oxygen or superoxide radicals, hydrogen peroxide nanomolecules, OH radicals, and these reactive species could be generated from molecular oxygen or water which is present in the biological system. So these reactive oxygen species just could trigger a program cell that called as apoptosis and necrosis. All these reactive oxygen species which are called as ROAS could able to just destroy the cancer cells. Well, so how nanomaterials can generate heat and ROS? So these are typical, it's called as Javelinski diagram, where you can see that this is a nanomaterial here, we are exposing the light, the electrons in the ground state that will go to the excited state. And again, when the electron is coming back, so here the two type of phenomena. One is a fluorescence, means simply light will be emitted. This is a radiative process. Another is non-radiative process, means the electron will not emit the light, and that would convert it to heat. So the heat would causes to burn the cell. Another sense, the electron in the singlet state would just go to the triplet state by intersystem conversion, and again here the light would come back to the ground state. So which can just can emit the light, then it is called as phosphorescence or below fluorescence. If not, if it's a non-radiative process, then the light would generate the heat. Again, this heat can burn the cells. So this is what involved in the photothermotherapy, and such how materials could kill the cells or burn the cells. Another sense, from the triplet state, the electrons may take the electrons may interact with molecular oxygen, and the molecular oxygen would be in a triplet state, and that can just convert into singlet state. Means the energy would be transferred to the oxygen, and the oxygen would convert into singlet oxygen. And this singlet oxide creates a lot of reactive oxide species. And such how the cells will be died through apoptosis or necrosis process. Right, so what are the different nanomaterials for phototherapy? So far has been demonstrated. Most of the nanomaterials have been used for as phototherapeutic materials like organic nanoparticles like dendrimers, like polymers, silicones, and hybrid nanoparticles like hydrogel, and inorganic nanomaterials like carbon nanotubes, mesoporous materials like silica, gold, iron, quantum dots. So a lot of metal nanoparticles or even organic nanomaterials has been demonstrated for phototherapy because they can absorb the light, and the light could be converted to heat and react to oxygen species. When come for the carbon nanomaterials, as we discussed, carbon quantum dots, graphene quantum dots, fluorines, carbon nanotubes, and so on. Carbon nanohorns, and there are many nanocarbons are there, but here our choice is the graphene. And graphene could able to generate the heat then that could burn the cell, that is called as photothermotherapy. If it could able to generate singlet oxygen, that is called as photothermotherapy. That's how graphene could able to generate the heat or singlet oxygen. Wow. So when you just see in a UV visible NA spectra of graphene materials like graphene oxide, this is graphene oxide, or graphene, or reducible graphene. See, it has very good absorption in UV region, but it has less absorption in the visible and NA. So a lot of research has been demonstrated by using bare graphene oxide and reduced graphene. So it has less absorption. But in an ideal material, we need a material which could have very good absorption in the NIR regions, visible or NIR region. See, this is a typical graphene oxide. It has only absorption in the UV region, but very less in the NIR regions. So we need a material which has a flat absorption or very good absorption in the NIR region. So how to just get these materials? So that could be done by functionalizing with different polymers or any other materials. Right. So here is my research. Just refunctionalize graphene for imaging and therapy in one region. So in order to achieve very good absorption in the NIR region, I have taken graphene oxide. This one has very less absorption, and after that just we reduced in terms of microwave oven at 1 minute. So we got reduced graphene. In order to just go for MRI imaging, we make it magnetic. So in order to make it magnetic, we have ferrocene molecules. So graphene oxide and ferrocene under microwave radiation, we got magnetic graphene. But magnetic graphene is not water soluble because it does not have any oxygen contributions. Later on, we function with acrylic acid. In order to just give a water dispersibility. And in order to go for fluorescence imaging, we function with fluorescent methacrylate. We're adding acrylic acid, fluorescent methacrylate, and a PPO, which is a radical initiator under microwave sonication. These two molecules, these two monomers will function on top of the graphene. As a result, we got magnetic and green fluorescent water-soluble graphene, which is also called as functional graphene or multifunctional graphene. And this metal is good for imaging and photothermal therapy. But in order to check photodynamic therapy, we just function with SINC, silicon naproxanine, which is a singlet oxygen generator or singlet oxygen sensor, which could able to generate singlet oxygen in presence of light. So the process up to here, just we adopted covalent chemistry. To covalent bonding, we able to functionalize the molecules on top of magnetic bond. Whereas this is non-covalent chemistry. By taking the advantage of pi-pi interactions, because it has many pi electrons, it also has many pi electrons. So to do physical absorption, we functionalize silicon oxide on top of it, and after we got MFC ions here, we administer this one to the killer cells. And we went for imaging and therapy. As it is fluorescent, just we can see the material inside the cell, and upon NIR radiation, we got very good therapeutic efficacy. Right. So here is the characterization of the material what we prepared, and here is the UV visible spectra. where you can see a graphene oxide has very less absorption in the NAR region, and whereas the functional graphene or multifunctional graphene has a flat absorption. It means it is an excellent one and very good functionation has been happened. And we are expecting that it could able to absorb a lot of NAR light in this future. Later, in order to go for photothermal therapy, we tried to check it whether it could able to absorb the light and generate the heat or not. When compared with the water, the platform, second one is SiNC4, the photosynthesizer, the MS4. We got MFG and MFG SiNC4 has very good capability of generating the heat. As a result, so MFG or MFG SiNC4 is a very good candidate for photothermal therapy. Well, as it has silicon naproxen, would like to just check it out whether it could able to singlet oxygen or not. Because singlet oxygen, if it could able to generate singlet oxygen, so that we can get a synergistic photodynamic therapy too. Yeah, so if you can see the spectra, this is called as phosphorescence spectra of silicon naproxen for red color, and MFGSN for means silicon naproxen functionalized multifunctional cloud. Where you can see that when compared to SiNC4, energy has less intensity, but it could able to generate singlet oxygen too. Means it's an indication that at a 265 nanometer peak, there is a phosphorescence peak, which is corresponds to singlet oxygen emission. So in this way, you can say that it is a good candidate for PVT. Upon light illumination, it could be able to generate the singlet oxygen so that photodynamic therapy could be possible. Well, so once we prepare the material, we administer or we add the material like energy essence for to the fluorescence. Where you can see this is for control stained with the DAPI and it can reflect the blue color, and P is for the green emission from MFG essence, MFG alone, because we just now control with fluorescent or the metacolite, where the red channel is corresponding to SiNC4 because it could able to generate a red color. And the D for the combination of A and B, and E is the combination of B and C. And whereas F is the combination of all, means that the fluorescence emission is purely from the nanomaterial, not for any other background emissions. Means that from this slide we can conclude that the MLC has been internalized into the cells through non-targeting pathways. Well, so we also just went for in vivo imaging and just through intravenous injection we injected MLG-74 about 50 microgram per ml, where you can see that the material has reached the tumor and it has a deep fluorescence there. Well, so in the preliminaries, we went for in vitro studies. Well, here is an MPT assay. We add the nanomaterials to the cells and just we check its capability in dark as well as under NIR light. Where you can see that this is for control, and here this is for 0.01 micromolar of SiNC4, and a different concentration you can see the at the x-axis, and whereas y-axis for cell viability. Yeah, here the pink one is for essence for alone, the green one for essence for in photo. See, the both in both the cases, essence for in dark and photo has no much effect because essence for is an organic compound and that could not able to enter into the cell. That's why we need a drug carrier. Well, whereas you can see MFG essence for is also do not very effective in the dark, but when you just illuminate NR light, you see that there is a decrease in the survival rate of the cells. Even at 0.20 micromolar of SiNC4 on top of MFG has very good therapeutic results. See here, they almost have zero survival rate. These for both combination of photothermal therapy and photodynamic therapy in dark and light. Whereas you could like to see that what is the contribution of MFG from photothermal therapy. Means here we only just added MFG without sulfonafloxacin a photosynthesizer. The blue one for dark and the purple one corresponds to light. Means under light irradiation what the efficacy of cell killing we have been observed. So when compared with the dark we got better results but not that effective from photothermal therapy alone. So we can conclude from this slide that the synergistic photothermal therapy has given very good results. And this experiment is done by using NIR1 splitter. Next one. So phototherapy in NIR1 and NIR2 levels means at a lower wavelength and higher wavelength. Where you can see that we have same the graphene functional with polyalkylic acid or fluorescent or the methacrylate, just we add it to the cell and just we treat it with 848 nanometer and 1064 nanometer. As you can see that the materials GO and RGOPA or MFG has very good absorption in NIR1 window and NIR2 window. So as it has very good absorption, we try to just treat the cells with both the lights. Well, so here is the empty assay in top conditions. We added RGOPA to the halo cells. In the top condition without light, you could see that though the concentration has been increased, the survival rate has not affected much. About 80% of cells are viable. Whereas in just in presence of light, means 808 nanometer and 1064 nanometer, so with the concentration, there is a decrease in the cell viability has been observed. But still, this experiment has to be optimized. So we can say that 50% or more than 50% cells are inactive in both the windows. Well, as evident that whether it could able to generate the heat, we have the heat shock protein expression assay. With the increase in the concentration, you could see that compared to the controls, means that compared to the dark, in case of 808 nanometer or 1064 nanometer, you could see very good heat shock expressions and it has been increased with the concentration. It means that here the cell death happened completely because of a photothermal therapy. As there is a photosensor here, we did not done any photodynamic therapeutic effect. If you could just functionalize this material with photosensitizers, we hope that we get just very good healing efficacy. Well, next, so we treated the same material to SRS. SRS has very good drug resistance. That's why phototherapy is very effective for such a drug-resistant bacteria. Well, so when we add just RGOPA to the SRS in the dark, there is no much effect in bacterial survival. Mostly 80% above of the cells has been survived even at high concentration. But in presence of a light, both NR1 and NR2 light, you could see that even at low concentrations, that's very effective in the inactivation of bacteria. Well, so there's the plates, this for control, and this for 808 nanometer and 1064 nanometer in the dark, and this is in terms of light. So in terms of light, you could see most of the cells are killed. So from this we can conclude that so RGOPA is very good to inactivate bacterial cells and even cancer cells in vitro. Right. So when come for the conclusions, we have successfully prepared functional graphene, MHC, and RGOPA. The MHC can kill the cancer cells by photothermotherapy and photodynamic therapy in NR1 window, and the MFG and RGOPA exhibit a wide range of NR absorption in both biological window 1 and 2, and the heat profile shows a maximum temperature of 63 degrees centigrade, and it can freely heat the cells and pathogenic bacteria SRs in the NR window 1 and NR window 2. Thank you for your attention and listening my talk patiently.
Thank you,
Is there any
Dr.
question?
Ganesh, for your presentation. So, anyone having any questions? So, no questions. Thank you once again for your presence and presentation.
So thank you. So thank you for the invitation and the opportunity. Thank you.
Thank you. So, our next presenter is Dr. Osman Y. Ensene from University of Hull, United Kingdom. Hello, Dr. Osman. Hello, Dr. Osman. Are you with us? Hello, Dr. Usman. Yes, your screen is visible now.
Okay. Can you
Can
hear
you
me
make it
as
a
well?
full screen? Is it a mobile? Can you make it a full screen?
Let me see. Uh, 1 second, please.
Okay.
Yeah, it's just a lot of the transport issues. It's just the I don't know to go to the mosque on Fridays. Yeah, so whether it's just an excuse that they can do with their friends, which is usually the main motivation. Yeah, that's the person that left their keys. Yeah. Got it back. It came back. Yeah, eventually, yeah. Okay. So thanks for sorting that out. I put a message on campus. Right. There was a better. And then, so the students saw that, and then
Hello,
by
Dr.
mistake, so I
Usman.
went to the then building and left it there. And he messaged me to say picked it up. So it worked out.
Yes, perfect. Please continue presenting. Hello.
Hello.
Yes, please start
Can you hear me now?
presenting. Yes, yes.
Okay. Thank you so much. Okay, I'm gonna start now. I want to
Yes.
apologize for the delay. I'm having some technical issues. You can see I had to connect my phone as well as the computers because the microphones on the computers are not working. So I had to use my phone to talk while I do the presentation from the screens. So, hello everyone. Thank you for your patience. My name is Osman. I'm going to talk on laboratory screening of a variety of polymeric and biomass waste for chemical transformation into valuable product. I'm from the University of Hull, and I am happy to be here. So, from here, the background here is introductory. You have waste plastics, and you have swimming caps here, swimming caps there, Yeah, so those are the waste, and then we have the thermal recycling, um, which could be pyrolysis, and you can also use catalysts, as seen here. You have the polymers, the biomass, which supports the process. You have useful materials that can be produced, such as floor tiles. You have adhesives, as well as waxes that can be produced. It can be produced from this waste here. So, introductory waste plastics, swimming cups. You have biomass in the problems in our environment with the PEs, polyethylene plastics, being dominant in municipal waste, and these cause problems such as pollution, sea flooding, contamination, um, as well as water contamination, as these plastics or these wastes decompose over years, over time, and they sink into the oceans, into the bottom rocks, and affect water that we drink through boreholes, as the case may be. So, thermal and catalytic recycling can be one approach that can be used to solve these problems. And at the end of the day, we're able to get rich materials or other potential products. You can see here biomass is a plant material fuel. It could be wood or grasses. There's residue from agricultural products, as the case may be, and these can be used to support the recycling process, as seen from here. This is actually a pallet energy system to support the pyrolysis process. So, plastic swimming cups, like I mentioned, we have pallet energy here, industrial applications, as they can be used, these waste plastics. So waste in general can be used at industrial scale level, as supported by research, and to generate new products. And like I mentioned earlier, the most dominant waste plastics use the polyethylene, PEs, as well as PET, also making noise, if I should say, around the world, with the US being one of the largest producers of these waste or plastic use, and global quantity rises over the years, as reported by this author in 2018. So the environmental challenges are huge, like I mentioned earlier, such as pollution, groundwater contamination. Even the oceans have been flooded by these waste, these swimming cups and plastics, and those affect marine life, and which affect us again through the food chain, because if these marine life engulf these waste plastics or waste swimming cups, they become part of their body, and if we eat these species, such as fishes, we tend to be affected, which sometimes can cause cancer-related issues, health issues. So the thermal recycling and catalytic recycling, as I mentioned earlier, these are reputable ways that can be used to transform these waste plastics into useful products. You can see here, we have the thermal method, we have a catalytic method wherein a catalyst is used. That's the plastic. Waste plastics could also involve other different types of waste, such as the swimming cups, and these can be converted into useful products like floor tiles, which is seen here. So this is the thermal method without any catalyst. Here is a typical explanation, a demonstration of forming useful materials such as floor tiles from waste plastics and swimming caps. These are other processing conditions that can be taken into consideration in forming these new products here as seen. And here is a practical application of floor tiles. They can also be used for indoor purposes. This talks about the durability of floor tiles. This could last for 50 years, as reported by this author. Temperature conditions can also affect the condition in India, which is normally hot, if I should say. And if the weather is hot, it might tend to affect the longevity, perhaps not up to 50 years. If it's cold, then it could last longer. So 50 years is just the average. So for a conclusion here, the environment will be safe, human capacity will be built with these people are employed to do these transformation processes of waste plastics into useful products. We get flow tiles from it, we have adhesives as well as biomass, waxes. And these flow tiles can be used for infrastructural development, which at the end of the day will support economic growth. And of all of these is best to support the Paris Agreement to net zero by 2050. I would like to acknowledge the Commonwealth who have been sponsoring my studies over the last years, as well as the University of Hull and my primary supervisor, Dr. Zain. These are some of the references that I've used in this presentation. Most of this work have already been published in my other publications. You can see from there. If you want to, you could access to get more information on these. These are references. These references could help immensely to support your vid. I want to thank you for your time. Should you have any questions, I'm happy to take them. In any case, I can also submit my email address if you have questions in the future. I am more than happy to receive them. Thank you.
Thank you, Dr. Usman, for your presentation. So anyone having any questions? So no questions. Thank you once again for your presence and presentation.
No problem. Thank you so much for your time.
Bye.
Really appreciate this.
Thank you. So our next presenter is Dr. Brandon Luke Wold from University of Florida, USA. Hello, Dr. Brandon.
Hello, thanks for having me today.
Yeah, that's going on. So I have make you the presenter. You need to click on the share icon at the bottom of your center of the screen.
One second, real quick, I have to change the preferences to do so.
Yes, yes. If it's a MacBook, you have to give the permissions in system preferences. Then you have to log out and then you have to log in.
Okay, one second while I do that.
Okay.
You're able to see my screen?
Yes, you can make it a full screen and start presenting.
So thank you very much for having me present today. So I'm going to talk a little bit about exploration of treatments for subarachnoid hemorrhage, and then some ways that we can improve the disposable products that we use in the long term as well. So just a little bit of a background. So subarachnoid hemorrhage is a fairly common disorder. There's about 2% of the population that has brain aneurysms. This is the common location that they're located. The anterior communicating artery, posterior communicating artery. You can have basilar tip aneurysms, pica aneurysms. And so a little bit about what these aneurysms are. So they're like little blubbings and weakening of the blood vessels. This shows like an aneurysm that has enlarged and caused a subarachnoid hemorrhage when it ruptured. So there's different treatments that we do. This is a 3D angiography, really showing the aneurysm a little bit better along the posterior like Pica infundibulum. So what we can do is do treatments. These are typically with coils. So for each of our devices, we have the single insert packaging from the FDA. We use a high level of different types of plastics and different types of polymers. There's been a big push within our field to try to really streamline this to decrease the medical waste because that has high potential for increased pollution and detrimental like effects. Hospitals are one of the highest generators of waste. So we're really conscientious in trying to improve the treatment options. So along those lines, we're trying to understand the disease pathophysiology better so that we can really like streamline treatments going forward. So for subarachnoid hemorrhage, there are several different paths that are disrupted. There's an increase in fibrinogen. There's an increase in the microglia and astrocyte response. So these are like the brain immune cells as well as some supporting matrix. There's also aquaporin 4. This can lead to disordered water transport. And there's this new system that's been described over the last couple of years called the glymphatic system. It's pretty much the brain's lymph system. This can be clogged up with the blood after subarachnoid hemorrhage. So these aquaporin 4 channels typically aid in transport, help clear products out of the brain after injury. When they become disrupted, it can lead to metabolic waste, can clog up these lymphatic channels, and that's been a key source of headache generation as well as detrimental outcomes in terms of spasm generation as well. There's some new receptors that are been discovered specifically targeting the CGRP pathway, and so there's some interesting drugs that have just come to market. So it can really help streamline our treatment approaches instead of taking the patient back to the angio suite, which would require a lot of equipment, increased waste. We can potentially target with more pharmacologic mechanisms and have better outcomes. Still in its infancy, but hopefully coming down the pipeline. There's triptans that are used for migraine headaches. The CGRP acts in a similar mechanism by altering serotonin release. There's a couple different ones that have made it to market, including antagonistic components. These have been used for migraines, but this would probably be pretty beneficial for our subarachnoid hemorrhage population as well. And the main reason that they would have therapeutic benefit, as we discussed, is that there can be some spasm that develops on the vessels. So here's the astrocytes. They become reactive after the blood component causes the clogging of this aquaporin channel. And this ultimately can constrict down the vessel, leading to spasm. And the reason that is clinically significant is when the blood flow supply is decreased, there's a high risk for having ischemic stroke as well. So some of these new targets can open up those vessels in a more systemic way. Historically, we've had two options where we can take catheter up, go shoot some calcium channel blocker and try to open up those vessels temporarily, or put in a balloon and try to dilate that vessel, which is risk for vessel rupture. Another component that to this pathway besides the astrocytes are these reactive immune cells, these microglia. And so there's specific targets there targeting interleukin 6, phospho-STAT 3 that have therapeutic benefit. We're starting clinical trials now to see the efficacy in improving outcomes. Historically, as well, there's been systemic treatments for the headaches. So opiates have been the classic, specifically activation of the mu opioid receptors, and this has been providing nociceptive targeting. There's also corticosteroids that have been beneficial. This decreases some of the inflammation that has occurred. It's more of a systemic approach, though, so it's very broad sweeping. Really hasn't played out the results that we had originally hoped for. So, as I mentioned, we're really targeting more specific pathways going forward. There's gabapentinoids. So these block specific voltage-gated calcium channels. They have some efficacy in specific patient populations, but they are not successful for persistent headaches. So the CGRP antagonist might be more beneficial in the long term. We frequently use acetaminophen. The benefit is that it doesn't have the increased hemorrhagic risk that is associated with NSAIDs. But the NSAIDs and acetaminophen work temporarily. They don't have great efficacy in the long term. And then one of our most common one is acetaminophen, butalbital, and caffeine. These exert a more protective effect, especially the caffeine component. There's always a risk of having progression to spasm as well. So they're used conservatively. And there's some experimental treatments that haven't really played out super well. These include magnesium, increasing sodium, that seems to help with the headaches. There's local lidocaine administration, and then there's administration to decrease sympathetic activity that has been shown to provide some benefit as well. And then switching over to the specific headache pathways, there's the triptans, which have been used. The CGRP receptors, as we'd mentioned, are just coming to market and are being used in this population. There's local blockades that can be administered through injection. These have pretty promising effects and are starting to be used more consistently. And then CSF drainage through external ventricular drains is something that we commonly employ. So here's some experimental model. What it's showing is that there are these microglia, which are green. This are the immune cells of the brain. But what's happening after injury is that there's these peripheral activation of macrophages that are entering the brain and causing this increased inflammation. So if we can target these pathways more successfully, we can treat the aneurysm but keep patients from having to come back for the OR for subsequent vasospasm treatment. Has substantial improvement in decreasing waste. We are working on new products as well for increased aneurysm healing in a quicker fashion using biodegradables. So that's coming down the pipeline. So in conclusion, subarachnoid hemorrhage has very high morbidity and mortality. 50% of the patients never make it to the hospital. For those that do, we're really trying to target the headaches, that spasm, and really decreasing the risk for stroke. So improved treatment options that are currently being developed are going to improve outcomes for patients. There's novel investigations specifically into headache management and for vasospasm treatment. So hopefully these more systemic treatments that are offered at bedside can help decrease the waste from repetitive trips to the OR. And we also are working closely with companies to very strategically design products that limit environmental impact. So we've, as an organization, have been really trying to limit the packaging inserts that are needed, try to make more biodegradable packaging instead of the normal plastics with increased polymer density. And we're also really trying to limit the overall trips to the operating room because that can drastically reduce biomedical waste. But with that, I'd be happy to answer any questions.
Yes, thank you, Dr. Brandon, for your presentation. So, anyone having any questions? Okay, no questions. Thank you once again for your presence and presentation.
Thank you for having me.
Yes. So I want to just ask Dr. Zoana, are you interested to present Dr. Sandra's presentation today? Hello, Dr. Zoana. Hello. Hello, Dr. Zoana. Okay, so by this we came to end of our webinar, day 2 webinar, as we have completed all our talks. Thank you all for making this a successful one and hope we will meet in our next conference. Thank you and have a nice day.